From the 22 News Plus studio, this is 22 News in Focus with Patrick Berry.
Hello, everyone, and welcome to this edition of In Focus. I am your host, Patrick Berry, and today we are talking about the need for food in our communities. I don't know about you, I get hungry every single day of the year, no matter what day or month it is, and there are many members of our community who fall into that same category, yet they don't have the food to eat every single day. Joining me across the desk today is Andrew Morehouse. He is the Executive Director of the Food Bank of Western Massachusetts. Andrew, thank you so very much for joining me today.
Thank you.
We're in late 2025, and this is the time of year everybody thinks about making a food donation or a monetary donation to help feed our neighbors. But as I pointed out, I get hungry every day. You get hungry every day. There's a need for food 365 days a year throughout our communities. And that's where the Food Bank of Western Mass helps.
Yes, absolutely. And you stated correctly that not everyone has the means to put food on their table, and that's why the food bank exists. We are the region's food warehouse, resource, education, and advocacy center. That's a mouthful. I say that because we do a lot of stuff.
Right.
We provide nutritious food to 124,000 individuals every month. This is the highest sustained level of food demand in the food bank's more than 40-year history.
Okay, give me those numbers again.
120, well, actually, it's almost 124,000 individuals every month seek out food assistance through an elaborate partnership of 199 community food pantries, meal sites, and shelters where these people go to receive a bag of groceries or a hot meal, depending upon their need. And those 199 food pantries and meal sites and shelters get most of their food from the food bank warehouse located nearby in Chicopee, Massachusetts.
So I think about that number, 125,000 people. That's, give or take, the population of Springfield.
Yep, a little less, but
that is amazing that that many people in our communities need food.
Yep, and we're talking about the 4 counties of Western Massachusetts, all of Berkshire County, Franklin County, Hampshire County, and Hampden County. And what's important to note is that a recent study by the Greater Boston Food Bank found that Franklin County, one of the poorest rural counties in the Commonwealth, and Hampden County, one of the most challenged, more urban communities, actually have the highest food insecurity rates out of all counties in the Commonwealth, 50% and 54%, respectively.
What is the cause of that? You talk about Hampden County being an urban county, Franklin County being not as wealthy. And I don't even want to say wealthy is the right word, but just don't have the income and means. Are those the driving factors, or is there some underlying issue? I know you and I talked during my Mass Appeal days during COVID that COVID was a problem.
Sure.
But COVID is now 3 years behind us. What are the driving factors now?
Well, clearly at one level, it's being able to earn a wage that supports your family. So it's income, but it's also the high cost of living. Right now, we know housing prices are really high. Everybody's feeling it. Utility prices, transportation costs, and of course, food prices are all. You put those two together, and those are like the proximate drivers. But behind that, there are all kinds of other causes of hunger and food insecurity.
You know, it's interesting. I was reading an article recently that the strain on people's personal finances. Like you and I have jobs. Right? We have an income, but our health benefits, our participating portion of our health benefits going up 6%.
Yeah.
The average raise is 3 to 4%, but inflation is almost 3%. So like one step forward, 2 steps back. That for just the average person, that hurts. You don't have to be unemployed or underemployed to be struggling.
Right. And clearly health and food insecurity go hand in hand. Many people may remember and have heard the phrase, food is medicine.
Right.
Yeah. So to the extent that people aren't food insecure, don't have access to nutritious food regularly, they're going to be less healthy. And that's going to drive people to seek health
Medical care,
assistance,
yeah.
medical care, whether it's an emergency room or what have you, and that's driving up the cost of health insurance at a time when the federal government has just nixed Medicaid, and we're challenged right now, and both sides of the aisle would agree we have a broken healthcare system.
So do you? I guess in the way you just explained it is it's lifestyle. If people were able to eat healthier more affordably, then their need for health care, medical services would decrease, which would decrease the increased cost for each of us for our medical. So it's a circle. Everything affects each other.
And those are just parts of it, right? There are a lot of other causes to both food prices and the high cost of living in general, and of course the cost of medical care. But they're certainly correlated, and of course that's one of the things we do at the food bank. We provide nutrition education and other forms of food assistance, so that, for example, patients who go to health centers or hospitals and are screened food insecure are referred to the food bank, and we're able to provide medically tailored meals to address their chronic illnesses and their food insecurity at the same time. So that's an example of one of the many things that we do at the food bank, including in what I'm doing right now is raising public awareness about food insecurity, and we hope through that more people will get involved in supporting us to promote systemic policy change so that we can actually end hunger someday, at least in the Commonwealth of Massachusetts.
That's the goal, right?
That's right.
We are up on our first commercial break. We're here with Andrew Morehouse from the Food Bank of Western Mass. We'll be right back after this.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back to this edition of InFocus. I am your host, Patrick Berry. We're here in the 22 News Plus studios. Across the desk from me is Andrew Morehouse. He is the Executive Director of the Food Bank of Western Mass. Andrew, thank you so very much for joining me. I appreciate it. Just before we went to break, we talked about some of the statistics and, how you and your partner agencies are, doing whatever you can to reduce those statistics, but it's not getting any better. It seems to be it's getting worse. Do you know, is there a simple fix, or is this a multi-pronged approach socially, politically, economically? Is it a multi-pronged approach that we all need to understand that this is a crisis?
You answered it. It sure is. Yeah, there's no simple fix. There's no silver bullet. It will take lots of effort by lots of people through lots of different approaches and policy change and innovative ways of getting food to people when and where they need it at the moment to ultimately end hunger. I think it's important to put a face to those statistics. I said earlier that about 124,000 individuals every month are receiving food assistance. Well, who are these individuals?
Well, I'm glad you say that, because in my head, and I think a lot of people think, you drive through some of our bigger towns, Springfield, Northampton, Holyoke, and you see the homeless people that are out there. We all know they need the food, but there aren't 125,000 homeless people around here. So who needs the food?
Yeah, well, in fact, half of all people who receive food assistance are children and elders, the most vulnerable in our community. Right. But because we were talking earlier about the high cost of living, even working families, earning minimum wage or near minimum wage, meaning more than minimum wage incomes, are unable to make ends meet and put food on the table. And there are a variety of reasons for that. And mainly it's because, the high cost of living. And so, you have folks who are working really hard and they still can't make ends meet. That doesn't seem right. They're doing their part.
And I have heard that there are groups of people who, as they progress in their career, it's actually a backward step. So, I might get promoted here at 22 News, but because my income level went up just a little bit, I'm now no longer able to receive certain federal or government benefits. Is that part of what you're seeing?
Yeah, and we call that the cliff effect, that individuals who are trying to get ahead in life, they want to work full time, they want to accept that promotion at a higher wage, but perversely, the way our social welfare system is set up is that they're immediately cut off from benefits, as opposed to gliding them and assisting them to be
all or nothing.
Yeah, it's all or nothing to be successful. And so that's oftentimes what we find is that trap. And so working families can't get ahead. And so there are innovative ways that we're a part of out here in Western Massachusetts to drive pilot projects that will hopefully lead to policy change, so that we're actually helping people become successful and self-reliant and not reliant on public benefits year after year, and perhaps generation after generation.
Yeah, generational. We've talked, on the positive side, generational wealth, but there's generational poverty, generational hunger. Switching gears slightly, the talk this fall has been about the government shutdown.
Yep.
How has that affected what you do and the community, the 125,000 community members who rely on the food bank?
Right. Now, that's an important question. And at one level, at this very moment, nothing has affected us.
Right.
We receive funding from the federal government to purchase food. We've ordered that food for the next 2 months, so we certainly have food from the federal government, and we have increased amounts of food assistance from the state government, and we are receiving droves of donated food from the private food industry. We need more, but we can't order more food from the federal government during this federal shutdown. Our biggest concern is that the federal government, through the U.S. Department of Agriculture, just announced that they say they don't have funding to provide SNAP benefits in the month of November. And that's a big deal, because in Western Massachusetts alone, there are 191,000 individuals who rely on the federal SNAP program, Supplemental Nutrition Assistance Program, to go and purchase food at supermarkets to put food on their table.
191,000 people.
That's right.
Rely on SNAP.
And if they don't receive those benefits, they're going to turn to their local food pantry for a bag of groceries or a hot meal. And those 199 local food pantries and meal sites in Western Massachusetts are going to turn to the food bank for more food. And we simply can't make up for the loss of SNAP benefits. For every meal that the food bank provides, the federal SNAP program provides 9 meals.
Wow.
We would be overwhelmed. We have the capacity to receive, store, and distribute more food, but we don't have the food. And so we are calling upon everyone to reach out to their federal senators, Senator Markey, Senator Warren, and their federal representative, their congressional representative, and urge them to tell the White House and Congress to release the SNAP contingency funds that will pay for 2/3 of the cost of the November benefits. That is required by SNAP law, and that will buy us some time until we can find a solution.
And that's not just a Massachusetts problem or a Western Massachusetts problem. That's a national issue.
It's a national problem. Yeah. Nationally, 40 million people rely on SNAP benefits, 1 in 8 people, and they will lose their benefits.
1 in 8 people.
1 in 8 people in the United States of America rely on SNAP benefits to put food on their table because, as we talked about, they don't earn enough, or they can't work. They're elders or their children, or they can't find a job, or they certainly can't find a job that earns enough to put food on the table, or to pay their rent, or to buy their medicine. People are making excruciating choices between those.
We are very fortunate where we live here in the Pioneer Valley in Western Mass. We have a lot of farms, a lot of great family-owned farms. Do you partner, or the 199 agency partners, do you work with our local farmers to get fresh local produce?
Absolutely. Well, many of the food pantries reach out to the smaller farmers in their areas and are very successful in getting donations of produce, and some also have funds to buy produce. At the food bank, we are purchasing close to 600,000, 700,000 pounds of vegetables every year, and we are receiving in donations about 400,000 pounds of local vegetables every year.
Over 1 million pounds of local vegetables every
alone.
year.
And then we're purchasing produce from farmers as far away as Quebec, Canada. So we're bringing in over 4 million pounds of fresh vegetables, a fourth of which are coming from local farmers every season. And we even own 2 farms of our own and lease that land to local farmers who give us a share of the harvest.
You know, it's interesting. One of the topics we were talking about in the first conversation segment was healthy eating. And it's a cycle. If you're not eating healthy, you're eating poorly, it causes medical problems and so forth. So you have, several million pounds of local of produce coming into you. How do you teach people to use it? Because, you look at a head of lettuce and you're like, a bushel of celery, and you're like, all right, great. Do you teach people, or maybe not you?
At the food bank, sure.
We do teach people how to cook and how to use this
we
stuff
sure do,
to make delicious meals.
We sure do, because we believe to end hunger, it requires a holistic approach. It isn't only about providing nutritious food. It's about doing a lot of things, including nutrition education. Okay. So we have a nutrition team who goes out every day to local food pantries and other community centers and provides nutrition workshops on how to prepare healthy meals on a limited budget. And we provide recipes with the food items that we make available through the food bank, including fresh local produce, so that people know how to make nutritious food with the food that we provide and beyond that they buy with their SNAP dollars. And we also provide them with advice on how to shop at a local supermarket, to look at nutritional values of the labels that they're buying and the cost, to see which items they can buy that are lower cost and highly nutritious to get the most nutritious food to prepare nutritious meals. Yep.
We are up on our second commercial break. We're here with Andrew Morehouse from the Food Bank of Western Mass. We'll be right back after this.
This is 22 News in Focus with Patrick Berry. This is 22 News in Focus with Patrick Berry.
Welcome back, everyone, to this edition of In Focus. I am your host, Patrick Berry. Sitting across the desk from me is Andrew Morehouse, the Executive Director of the Food Bank of Western Massachusetts. Andrew, thank you again for joining me. Fascinating topic so far.
Yeah, appreciate it. If I could just try to tie a little bit what we've talked about. We talked about potentially 191,000 individuals in Western Massachusetts losing SNAP benefits in the month of November. And we talked about the importance of local farmers and nutrition education. And I think it's important for listeners and viewers to know that those 191,000 individuals who receive SNAP benefits cumulatively amount to $35 million every month in Western Massachusetts alone.
Hold on. Explain that again.
Yeah, 191,000 individuals in Western Massachusetts will receive, or not, the total of $35 million in the month of November to go to supermarkets or local farmers markets or directly to farmers' roadside stands to purchase food. And that amount of money is extremely important, not only for them to buy food, but it stimulates local businesses, individuals who work in those businesses, and farmers. And so that will have a severe adverse impact on our local economies if the federal government indeed does not provide those SNAP benefits.
So here at the tail end of 2025, I mentioned this very early on in this conversation. This is the time of year. It's Thanksgiving time, a time to give back and give thanks. Christmas, Hanukkah, all our major holidays are really, from November 1st to January, early January. But people are hungry year round. So how can we as individuals, maybe myself, our viewers, how can we help you and your partner agencies the other 9 months, 10 months of the year?
Sure. Well, I always say this. First and foremost, I encourage people to go to our website, foodbankwma.org, to learn about the issue of food insecurity and how you can get involved. Among things that you can do is please reach out to the local food pantry in your community and support them. Consider volunteering. And then, as I said, visit our website and consider making a donation to the food bank as well, because we are going to have to buy food with private dollars in order to respond to this increased demand. We cannot rely on the federal government, unfortunately, to help us meet the need. We can rely on the Commonwealth of Massachusetts, but we can't with the federal government at this moment in time.
Which is better, for me to donate cans of food that I get at my local supermarket, or give you money? Which is better?
That's a great question. And of course, it depends on the individual. But for us to have the greatest impact, dollars of donations enable us to buy much larger quantities of food at lower prices than we can receive in terms of donated food.
So if I'm at my local supermarket and I feel like I want to help out and I pick up a couple extra cans of soup or whatever, I'm just picking it out.
Sure.
Cans of soup, and I donate them.
That's important.
Maybe a can of soup is, I don't even know what a can of soup is nowadays. $1.99. It used to be 99 cents or 79 cents, but maybe we'll call it $2.
Yeah.
So I've just donated 4 cans of soup. That's $8.
Sure.
With that same $8 in cash or check or monetary donation, some way, shape, or form, you can get way more than 8.
That's
4
right.
cans
For every dollar donated, we can actually acquire the equivalent of 2 entire meals. And we do that through our purchasing power and the capacity of our new warehouse to attract and incentivize companies to provide large quantities of donated food. So I actually take that back. We encourage people to do both.
Okay.
To not only donate some of the extra items that you may have in your own food pantry or that you buy at a supermarket, but also consider making a cash donation to your local food pantry and the food bank, because collectively, with the donations we receive, we're able to attract, incentivize, and leverage vast quantities of donated food from the supermarkets that you buy your food from.
So you have the buying power that me and my neighbors individually just don't have.
And the capacity to receive incredible quantities of donated food. We have a warehouse that is 30,000 square feet.
And this is a new warehouse.
And this is a new warehouse in Chicopee. And we have a fleet of trucks to get that donated food out to 199 pantries and meals across all 4 counties, and to literally 124,000 individuals every month.
Now, how do you operate in the slower times? Like, let's fast forward to February. People are
there are no slower times now.
Well, there are no slower times for you because people are hungry 365 days a year.
That's right.
But there are, in the public's mind, we give, like I said, November through to early January. But how do you get people to understand that there's a hunger and a need for food 365 days?
Well, here's a very specific way of how we go about this. And this is a way the community can get involved. We invite everyone to join us for the 16th annual March for the Food Bank on November 24th and 25th, where we will march from Springfield to Greenfield over 2 days. And anyone can get invited.
Monte Belmonte, right?
With Monte Belmonte, that's right. And you can do that by checking out our website again. There are all kinds of ways you can do that. You can make a cash donation.
You don't have to do the march.
You can do a part of the march. You can walk for a mile. You can just stand by the march, and you can find the route on our website, and we'd be delighted to help you orient yourself on that. Or you can join us on our first ever Berkshire County mini march on the Sunday before, on the Sunday the 22nd, I believe. Indeed, Saturday the 22nd. And get involved that way as well.
And it's all at the website, foodbankwma.org.
That's right.
Andrew, I cannot thank you enough for joining me today. You and your staff and all your partner agencies do great work in our community. Keep up the good work. And folks, if you can in any way, shape, or form help them, please do so. We'll see you next time right here on InFocus. Thanks again, Andrew.
Thank you.
This is 22 News in Focus with Patrick Berry.